Hi guys, I'm Choni Selden and today I am at Jimmy Doji Wanchoo National Referral Hospital, and with me I have Dr. Phup Doji, who's been a gynecologist for the last 20 years here. Today we will learn about childbirth and the various methods of delivering a baby in the country. So doctor, without any further delay, I will go ahead with my first question. How many ways can we deliver a baby in the country?
We can deliver by two ways. One is the most common one is the natural way. So the natural way will be the normal vaginal birth, and the other one is by having an operation. We commonly call cesarean section. Yes. Now, if you look at statistics, about almost over 80% women can actually deliver normally. That is a normal delivery, we call it. And the other one, about 10 to 15%, usually women need to deliver by cesarean section. Yes. So by cesarean section, we have two ways in doing a cesarean section. One is women who has a medical condition in addition to pregnancy, who has some risk factors that may influence the mother or the baby. And in those groups, we pre-plan for a elective or a planned cesarean section. Yes. And everything is arranged on a specified date, time. And there is another cesarean section where a woman goes into labor, and on the way, during the process of labor, risk factors do come up, either affecting the baby or the mother. Then we go in for a emergency cesarean section. And that the time and dates are not fixed, so it can occur anytime. Mm-hmm. So these are the two basic ways the woman can deliver.
Do we give parents a choice?
At the moment, due to our limitations in our resources, including both logistic as well as human resource, and also all the expenditure is borne by the government, and parents actually do not contribute, directly pay for the services, we have not reached to a stage to offer deliberate inclusion of parents' option about the mode of delivery. Yes. I think what you really are hinting is a cesarean section on request, and that we are not offering because of the reasons I have explained. Yes.
There are actually a lot of benefits to delivering in a normal way, and I think that's one of the reasons the hospital is insisting that we try and give birth naturally too. So if doctor could mention few of the benefits to vaginal birth.
There are a lot of benefits with the vaginal birth. Firstly, if you look into directly compare, if somebody asks me what are the risk between a C-section and a vaginal birth. Vaginal birth is supposed to be 8 times safer both for mother and baby, much better. So there is a 8-fold benefit. Mother and the baby develop a better bonding quickly. Breastfeeding establishes more quickly. Mother leaves hospital more quickly. Mother returns to work more quickly. As compared to cesarean, all these are delayed. So those are in a cesarean, mother has to spend longer time in hospital, as well as longer time not able to return to work, longer time in establishing bonding with the baby, longer time in establishing breastfeeding. So these are some of the major issues which actually affect the pair.
As I was reading up on this, I came across the term microbiome system, or it's the healthy flora that is in the birth canal that gets transferred to the baby when baby is born vaginally. So could you explain to me one of the, I think, perks of delivering a baby in a normal way?
That terminology, yes, microbiological flora we call it. Yes. That means when the baby is born outside, inside the womb, the baby lives in a very sterile environment. There are no microbiological organisms inside. Once it is born outside, then the baby is bombarded with all the microbiological agents. And sometimes this can cause sickness to the baby. Now the benefit of having a natural birth is that when the baby is born, in the process, the baby's bodies and the mouth and nose secretions, they come in contact with the mother's microorganism, which is already there in the birth canal, and baby picks up this. And on top of that, if the baby touches the mother's body surface, the baby also takes up this microorganism from the baby's mother's outside the body. So now the baby has a similar microorganism compared to the mother. Now the benefit is if the baby gets sick because of these microorganisms that are picked up from the mother, the benefit is when the baby feeds from the mother with the breast milk, mother has already prepared, we call it bullets, antibodies, we call it bullets. Mother, because these organisms were living on the mother's body, mother's system has already prepared certain antibodies to fight this organism if they cause problem. If they don't cause problem, there is no problem. But when the baby gets sick and takes the breast milk, these antibodies go from the milk, from the mother through the milk to the baby, and baby gets protection. So this is the benefit.
Baby who's born through C-section never gets exposed to that healthy flora from the mother. Am I right?
Not the birth canal flora, definitely, but then the body surface flora, yes, because the mother touches the baby and there is a lot of, so definitely the birth canal flora, it is not in contact.
Yes, and there's also again perks of breastfeeding. How
Yes.
so even with a C-section baby, the mother can still bond with the baby and still be able to provide those antibodies through breast milk.
yes.
All right.
A new idea that I came across while researching was the practice.
A new idea that I came across while researching was the practice of delayed cord clamping. Could you explain to us about it?
Now, delayed cord clamping, it has been quite a concept that is being promoted nowadays. Initially, delayed cord clamping was practiced in babies who were delivered in the preterm.
Yes.
Preterm is a condition where the babies are born before their actually due date. So delayed cord clamping means that after the baby is born, there is still blood flow from the mother, from the placenta to the baby, and we deliberately wait for about, it varies from about 50 seconds to about up to 5 minutes, but on average about 3 minutes. So we let the blood flow from the mother to the baby. So the benefit is, if you put it in the real scientific context, there are two schools of thought with the term babies who have actually completed their days inside the womb. And those benefits are equivocal. Some they say there is benefit, some they say there is no benefit. But deliberate benefit is there for those babies who are born preterm, who have come out of the womb quite early enough. They do get benefit. And if you wait for about 3 minutes, there is a continuous flow to the baby. The babies receive about 80 to 100 ml extra blood, and that has a lot of high content of iron. It's a micronutrient that is necessary for the baby to in the development process, especially the baby's brain. So there are studies being done that babies who received cord clamping, that means they received extra 80 to 100 ml of blood with high iron content, and these ions stay in the baby's body, help in the process of brain development, and these babies do little better with a higher IQ later in the development process. So this is the evidence that delayed cord clamping for the preterm. And for the term baby, there are different schools of thought. So, but then if you practice, it is not harmful. But whether a true benefit is there or not, it's questionable later. But then, when the mother breastfeeds only exclusively, we call it exclusive breastfeeding for first 6 months, mother's milk is a poor source of iron content. So if you do a delayed cord content, definitely the baby will receive some extra iron to be used for the next 6 months of breastfeeding.
And I was reading that if we practice delayed cord clamping, there is a higher chance of the baby getting jaundice. But the hospitals in Bhutan are equipped with dealing with newborns with jaundice. Am I right, La?
Yes, on the other side, that when the baby receives more blood, the blood is not a permanent product that remains in the baby's product. It is time bound. In the blood, there are components we call red blood cells.
Yes.
These are time bound. These get destroyed by about 72 days.
Yes.
So within about 72 days, all this blood will be broken down.
Yes.
So the baby's body has to deal with a little bit extra red blood cells that has received from the delayed cord clamping. And in the process of destroying this blood, it converts into bilirubin, yellow pigment. That is called, when the yellow pigment is accumulates in the body, the condition is called jaundice, and it's called neonatal jaundice.
Yes.
And in the past, natural sunlight used to be a good source, but nowadays, because of all the modernization, the light has been introduced. It's called blue light therapy to break down the bilirubin for early secretion from the body.
Yes.
So, if you weigh the risk of baby developing jaundice versus benefit of delayed cord clamping, I think still the delayed cord clamping should be given more preference over the risk of baby developing jaundice in Bhutan.
Yes.
Do we practice delayed cord clamping?
Yes, we do. We have been, now there is a couple of years ago, we have started introducing the early newborn care. So that starts from at birth. With cord clamping it starts. So the main reason is that to reduce the new infant mortality. If a country wants to reduce infant, then with babies dying below 1 year, it's called infant mortality rate, which is quite high in Bhutan. If you want to reduce that, it is said that 70% of these babies below 1 year who die are actually babies who are just born and within below 28 days of birth. So if you want to reduce the infant mortality rate, you have to address the bigger chunk of the problem. It is addressing the newborn, early newborn. And even if you go down and look at the causes of newborn death, babies who are older, who are less than 28 days old, if you look into, the maximum of these babies who die are within the 7 days.
Yes.
So this is called early newborn death. So in that component, the birth the care at birth and around the time of birth is so important to save those babies who die in the next 7 days.
Yes. Wow.
So that's why it's a big initiative.
Yes.
So it's not only the cord clamping. So cord clamping versus, in addition with kangaroo care. These two go side by side.
Yes. Yes.
And then that also goes with early breastfeeding. So these three are trial, and the fourth one is a bonding.
Yes.
So all these go together as a package, right from the immediately after birth and onwards. Then the outlook for the baby is optimum.
Yes.
For delayed cord clamping, is it practiced only for premature births, or is it done for the term babies too, like in the
Here
country?
we do it for both.
Yes,
We put it for both. But in certain conditions, we don't do delayed cord clamping, where a condition where the baby actually needs immediate other life-saving measures, other resuscitation. Then we just don't wait for that, because cord clamping is only one-sided of benefit of blood going, but baby actually needs more oxygen and more other life-saving. Then there we do immediate cutting and do the resuscitation to save the baby.